So I would be talking about the basic principles of radiation safety. Okay. So we know there are various, always safety is a very important aspect. And when it comes to radiation safety, since there are many disciplines who are not aware of radiation safety, and so we thought radiation safety should be made aware to all the people. So with this, I thought I'll give you a brief overview about radiation. What is radiation? The units generally used, and we know radiation effects, it is useful. At the same time, we have to have regulations and documentations about respecting the threshold doses for a safe radiation practice in a medical organization. It's not only confined to medical, it's also for industries also, where we use radiation for the purpose of metal testing and other things. So I would be talking about the principles of radiation safety, the permissible dose limits as radiation workers and public, what we are entitled about, and we will talk about how the radiation is monitored in a medical environment and what are the regulatory aspects. So when we first come to the thing talking about radiation, what we always remember is Conrad William Röntgen. He discovered X-ray by an accidental experiment while doing with this cathode ray tube. Okay, so he just saw that invisible radiation and called this as the X-rays, and very soon he demonstrated that we can use X-rays to order for investigations to see a broken bone or a lung case for a pneumonia or a mammogram without cut opening the patient. So that invention became a very novel one, and he was awarded the Nobel Prize in 1901. So when we talk radiation, all radiations of electromagnetic radiation like light waves and everything have a common principle, which is they all travel with the same velocity of light, which is 3 into 10 to the power 8 meter per second. C, the velocity of light C is equal to mu lambda. Mu is the frequency and lambda is the wavelength. So since we know the velocity is constant, the wavelength and the frequency will be inversely proportional. If the wavelength is high, the frequency has to be lower. If the frequency is high, the wavelength will be low. So I will explain in the next one. Like if you look into this thing, the electromagnetic spectrum covers from radio waves to microwaves, infrared, ultraviolet. So they cover the infrared, ultraviolet. So up to ultraviolet radiation, these things are classified as non-ionizing radiation. And these non-ionizing radiations are used in power lines, radio, microwave, and everything. So although safety is important here, it's not that conscious like ionizing radiation, because the moment we come beyond the ultraviolet, the X-rays, gamma radiation, and the cosmic radiation, they have the ability to ionize radiation, which could be harmful and is certainly to be monitored well. So now if you see when the light waves and all, the wavelength is quite larger. So as we go on in the spectrum towards the ionizing radiation, the wavelength decreases and the frequency increases. As frequency increases, the energy of the radiation increases. And since the energy is higher, it has the capability to knock out an electron and ionize, and it can also change the DNA structure, which can provide a lot of catastrophic effect. So now let us ask this question: can we get rid of the radiation? If we look into the aspect, there is always natural radiation resources like potassium and many other isotopes which is embedded in the rocks and in the living organism, by which we always have some amount of background radiation. And one of the major source of background radiation is the cosmic radiation, which is beyond the terrestrial, and the atmospheric layer is a protective barrier for us. And since the atmosphere is not having a uniform density, we have a variation in this cosmic radiations. Plus, because of the uranium, which has a very off life of radiation, which is in the billion and million years, uranium and thorium, there is a radium, again isotope, which has 1600 years of off life, which has a counter product which can come into a radon gas. So these things invariably form some amount of background radiation in the food what we consume or on the water that we intake. So this amount of radiation almost has been documented by the global organization as the average annual dose is 2.4 millisievert. I will come to this units a little later, but please remember this. For radiation safety, we call them in terms of millisievert. Okay. And when we talk 2.4 millisievert, this is what is the background radiation contribution for an average. So you could see from the cosmic radiation for the diet what we inhale, or the air what we use, or from the terrestrial radiation, all to put together gives a 2.4 millisievert per year on an average. So if we assume that 2.4 is the millisievert per year, and this table is summating, giving you information about, you assume that 3 millisievert per year is the background radiation. When we do X-ray investigations, especially planar investigations, like the chest X-ray or the pelvis X-ray, when we do, what kind of a dose do we accumulate? Is it substantial? If you look into the thing, we have 3 milli. Here it is only 0.02. That means a chest X-ray is the one which consumes the lowest radiation exposure. Why? Compared to pelvis, chest consumes lower, because chest is composed of lung. Lung doesn't attenuate that much like a tissue or a bone. So in order to take a chest X-ray, you have to give the least MA and kV. So the effective dose by a chest radiation is only 0.02 millisievert. And if you take this as 1 unit, it is just like a 3 days of background radiation. That means doing one chest X-ray, the patient is not at all at a risk, because he is just getting 3 days of a background radiation. Inevitably, the background radiation is not that harmful, because we are all living in that, and we are not produced any considerable effect on that. So the moment from the chest X-ray you come to a pelvis or abdomen, it goes from that to 0.7 or 1, which means it goes 35 to 40%, 40 times higher. So even in planar X-ray, chest X-ray is the simplest and the X-ray which consumes the lowest radiation dose. So it can be frequently used for diagnosis. And then the pelvis and abdomen consumes about 40% of the dose of a chest X-ray. Now, the moment you come to volumetric imaging like a CT of the chest or CT of the abdomen, it further increases by 10-fold the radiation, like 8 millisievert, 10 to 20 millisieverts, which means it is like 3.6 times the average dose of the background radiation. Is that clear? So in order to say the chest radiation gets a larger dose compared to a background radiation, like 3.6 times the background radiation what you could have consumed per year. So now coming to the thing, talking about what is radiation and radioactivity. Radiation means, we talk about here in this lecture, ionizing radiations, which could be coming out from a X-ray machines like a X-ray C-arm or a linear accelerator like that, or gamma radiation which comes from a radioactive isotopes, or electrons and betatrons. Protons and heavy charged particles are also used for research purpose as well as therapeutic purposes. So radioactivity is a natural phenomena which we have already learned in many of our textbooks, that radioactivity has two kinds. One is man-made and another one natural resources. Natural radioactive materials generally have a very long off-life, and we have to live with that. But of course, the background radiation, when you compare it from Kerala to Kashmir, the Kerala part has a larger background radiation because of the rocks are rich in thorium content compared to the other parts of India. Coming to radioactivity, we have to remember one thing. Since it's a spontaneous emission, it spontaneously emits till it comes to a stable stage. During that, it produces either gamma, beta, or alpha, and it comes to a stable stage by reaching this. And if you assume that in this graph, if you assume a radioisotope just having a half-life of 8 days. What is half-life? Half-life means the original activity to be reduced half of its initial activity. The time period taken for the original activity to be reduced to half of the incident activity. So if you assume here that this was having 16 balloons, and in order to reduce it to 4 of its activity, it took 8 days. So next half-life, 4 it will reduce to 2 in another 8 days, which is 16 days. Next from 2 to 1 in another 8, which is 24. And so when you come up to 4 half-lives, 1, 2, 3, 4, the radiation is considered to be negligibly insignificant in terms of a radiation damage. But this doesn't hold true if the activity is very large. If it is a small activity which is used in nuclear medicine, we can assume that after 4 half-lives, we can dispose them. But if it is in a therapeutic department like this, our activities are in million curies, so that activity will be still sufficiently large enough. So coming to X and gamma rays play a vital role in medicine. The X-rays are produced in linear accelerators, C-arms, CT scanners, and etc. The advantage of X-rays is that it is having a radiation control on or off. That means when we are giving a radiation, the patient is also getting a radiation. There's a scatter radiation, and beyond the control console and the vicinity where the public is walking, they will get some amount of extra background radiation. But the moment the X-ray unit or the control console is switched off, there is no radiation. That means the radiation is safe. When it comes to the radioactive isotopes like a gamma rays, which either used in gamma rays or betas, we have isotopes like radium-226 or cobalt or iridium, which is used for interstitial brachytherapy. They always need to be housed in a big protective housing carrier. And from that carrier, they remotely come for a switch on position and switch off position. That means even when the radiation in the off position, the background radiation will be always larger. So that is the major disadvantage of the radioactive isotopes used for the purpose of diagnosis or therapy in the medicine. And just this slide to illustrate again, when we talk about different types of radiation, alpha, beta, or gamma, we have to remember that alpha particle is heavy charged particles which can very well attenuated in a thin piece of paper. When it comes to beta or electron particles, a wood or a perspex material will be a good enough material to attenuate. Whereas a gamma or a X-rays can even pass on through any concrete materials, and high density X-rays, they can interact with high density materials in the concrete with steels or something to produce neutrons. So when you have a very high charged X-ray machines, you do have neutron barriers to control the background radiation, so that the people who work beyond that radiation environment, because radiotherapy or nuclear medicine and radiology forms a part of the hospital. So the radiation safety takes into consideration though the public works, the adjacent areas, the patient public or the professional radiation medical fraternity working nearby areas are safe. So when it comes to another question, sorry. So another thing is, does all the radiation, their intensity may vary, but beyond that, for a same amount of intensity, does their biologic effectiveness is the same? The answer is no. Different radiation has different biological effects, mainly depends upon the density of ionizing radiation. In one aspect, in a physics aspect, we call it LET, linear energy transfer. That means in a cubic millimeter, how many radiations can pass through, that is called as a LET. And in a biological term, we call it a biological equivalent, relative biological effectiveness, RBE. So this RBE will be changing with different type of a radiation. So for X and gamma, it is 1. For beta, it is 1. Beta means electrons and beta where we use. For neutron radiation, it can range from 5 to 20. For alpha, it is 20. That means what we have to keep in mind is that if a patient is getting a neutron therapy, the doses would be much less for the therapeutic. And similarly, if you are getting a dose for by incident, you have got some neutron contamination or something, the biological effective will be 5 to 20 times larger. So for radiation safety, it is a very important aspect to see what kind of a radiation exposure a person has and what its biological equivalence would be in terms of to assess the hazard part. So since we are talking about radiation, we also remember some of the things when we learned about radioactivity. The Madam Marie Curie, discovered the radioactivity, and on her name the unit Curie was given. So Curie is a unit which is used, and the SI unit is becquerel. For radiation X-rays, we use Rontgen, and the SI unit is coulombs per kg for dosimetry purposes. But this Rontgen is an exposure radiation. That means from an X-ray, certain radiation are coming out, and it is an exposure. But after exposure, the absorption in the body will be different for bone, tissue, and lung. For lung, it will be 0.4 times. For tissue, if you assume it is 1, for bone, it could be vary from 1.4 to 1.8 times attenuating, which means the absorption done on bone would be larger. So we have another dose which is called absorbed dose in the form of rad or gray, used in the therapeutic purposes. Now, this is okay for practicing. When we come to radiation safety, we have another term what is called dose equivalent, where we call it as a REM, which means rad equivalent men, and the SI unit is sievert. You may remember that when I talked about the background radiation, I tell it is about 3 millisievert per year. So now, what radiation can do? Radiation could be beneficial when we use in radiotherapy or radiodiagnosis or nuclear medicine. It is also used in nuclear reactor to produce radioactive isotopes. Industry also, it has been used to test materials for cracks and other things. But at the same time, if they are not being used properly, and there is a thing, huge amount of radiation can cause death. It can have cancer induction, and long-term radiation effect can be producing genetic effects, and nuclear weapons could be created from these radioactive isotopes as nuclear bombs. So, is it dangerous? Yeah, radiation is dangerous. If we don't monitor it and have a safe practice, if the doses are larger, it can form cataract, it can have thyroid diseases, it can have functional changes, brain tumors, cardiovascular changes, reproductive health. So various things it could have. So now you look into this this graph, this chart, which I generally like it, because here the green portion gives the radiation doses which are within the tolerable regions. Like if you look into people who are often flying on the aircrafts, example the pilot, by virtue of going above the atmospheric pressure, he always gets a larger amount of a background radiation, like 9 millisievert per year. So, and the cruise. So even up to 20 millisievert, it has been considered to be tolerable, and there is no effect, which means even 1% also will not, no one will have a cataract or any other cancer induced disadvantage of a hair loss due to a dose up to 20 millisievert, not even 1%. So from there, when you come to moderate amount of radiation doses, like in the nuclear medicine or anywhere, even in radiotherapy, if there's a radiation source struck or some radioactive isotope was been removed by mistake by a vendor and given it to a scrap dealer and it got into the public or anything, these radiations, then there's a possibility of having a radiation dose something like this, 100 millisievert to 1000 millisievert. And here you can have some mild effects of intermediate effects at putting a little risk. But the doses beyond 200 millisievert, these kind of a doses we have seen in the Japanese radiation accidents, and those history has taught us that these kind of a doses could lead to fatal effects, like 10,000 will have a fatal effect, and 5,000, 2,000 have really produced tremendous sickness to the patient, radiation acute sicknesses. And radiation by virtue, if it gets to a skin, it could have a skin burning. If it gets to the marrow, the cells will interact with the DNA and change the characteristics, and it produces a reproductive way. Okay, so now we know the radiation effect. When radiation effect, again, we can classify into two types of effects. One is deterministic effect. When we say deterministic effect, it has a threshold. You see the curve, up to a particular value, there is no effect. And after that, it forms a sigmoidal curve as a function of increase in dose. So the incident of the effect is in the y-axis, the x-axis is dose, and as the dose increases, the incident of the effect will form a sigmoidal curve. And this below the threshold dose, there is no effect. And even beyond this threshold dose also, it will be less than 1% of the persons may have such a kind of a incidence. It's very less chance still, but for the safety point, we have to respect this threshold dose. So beyond this threshold dose, if it can have a hair loss or cataract or a skin burn. And these are generally called a somatic effect. And this effect increases with increase in dose. The other effect is stochastic effect. Stochastic effect means it doesn't have a threshold, it is linear, and this can have late effects, and generally secondary cancer induced, or a leukemia, or a hereditary like a breast cancer coming up to the second or the third generation could be an effect of stochastic effect. Here, either it happens or it doesn't happen. It doesn't have that, the effect doesn't increase, the severity of the effect doesn't increase with the magnitude of the absorbed dose. Okay, so no threshold for stochastic effect. For deterministic effect, there is a threshold. Since, like, if you see deterministic effect, we have to respect the threshold dose, then we are much safer. When it comes to stochastic effect, there is no threshold dose. Whether you do a small radiation dose package or a large radiation dose package, the probability of the effect could be, and it's not necessary that the larger dose person only will get the effect, the lower dose person also may get the effect. So this is really producing a big challenge. That means from this we can understand deterministic effect as a threshold by which we can try to control, but stochastic effect we cannot control. So the radiation safety principle taught us that we should prevent the deterministic effect by respecting the threshold. The stochastic effect we cannot do that way, so we have to do limitation and apply as low as possible. We have to have the minimum radiation possible. So this is where radiation safety is much different from the other safety. Okay, a fire safety or a bioethics safety is different from radiation safety because no radiation is useful. So we have to see as low as radiation possible for public and understand the deterministic effect and respect the threshold dose. For that, we have regulatory bodies like International Commission of Radiation Protection, National Council of Radiation Protection, and for India, we follow the Atomic Energy Regulatory Board. So who is the regulatory body in India for giving us licenses, and whom all the medical institutions have to obtain license and have the inventories and have to monitor the radiation safety of patients as well as the area and the medical facility and report to them, and they keep controlling us. And now there are two more advisory bodies. One is International Atomic Energy Agency. So they do more research on radiation and its biological effect and suggest for documents for radiation protection. And like that, in India, we have Baba Atomic Research Center where they do have facility for making artificial radioactive isotopes as well as do a high-end research for medical as well as industrial purposes. Now I'm coming to the gear change, that when we say principles of radiation protection, we have to first have a justification of a practice, whether the benefit is larger than the risk. If it comes to initial, you should always try to see whether an ultrasound or a MRI can be done. But we know MRI is very expensive and cannot be affordable to all patients. So you have to see, like as I told, a chest X-ray takes a very low dose and it is not at all harmful because it's just a very small dose like 0.08 compared to 3 millisievert. So it is very safe to advise a patient even 5 times or 10 times a chest X-ray in a year. But is it true to advise a patient of a CT chest or an abdomen 10 times a year? May not be, because the dose is 100 times larger. So we have to see what is the risk versus benefit. Again, when it comes to female, okay, do the female population who are at the stage of giving delivery to the children in the pregnancy period, do they get an X-ray done or no? They can have a chest X-ray done, but when it comes to abdomen X-ray, definitely you have to think it out. What is the benefit versus the gain? And unless until the benefit is larger, you should not go for a radiation investigations. The other principle is that optimization of radiation protection is doses as low as reasonably achievable, which means if you can take a X-ray with 10 MA as and the image quality is good enough, you should never give MAs larger than 10 MA. Yes, especially for pediatric, always there is a dose care function in many of the C-arms as well as X-rays, the modern, to reduce the dose to pediatric patients and give the least dose, because you see pediatric patients are thin, they may not require the same kV and MAs. So this principle is applied across in all the radiation environment. Doses should be as low as reasonably achievable. Then comes the other important aspect, the dose limitation. When there is a threshold dose set for cataract or for skin dose or for whole body dose, we have to respect and we should not cross that. And again, there are certain regulatory concerns talking about the age limits, like students who come for working less than 18, the students, like especially the nursing students, the BSc students who are less than 18, their dose limits are much less. So they have to be placed on a area when they go for practical, on a safe area for practice, and they have to be monitored if necessary. So what is the recommendation? ICRP recommendation for radiation dose limits. Like for an annual, if a radiation, how do we do this? We always give badges to radiation professionals, which is doctor, nurses, technician, as well as attendant and ward boys also. So different people work for different aspects. So we keep monitoring them in a radiation area, how much doses they get. If there is anyone getting a larger dose, he goes for an investigation to rule out, is it genuine or not genuine? If it is genuine, then there are further investigations to rule out why that happened. So the radiation areas and radiation things are highly monitored for safe practice. So the Atomic Energy Regulatory Board as well as the ICP, international bodies, have recommended a dose limit of 20 millisievert per year for a radiation worker, any radiation worker. And this should be averaged over a period of 5 years, which means in a single year, he may get 30 millisievert, but consecutively when he is averaged over a period of 5 years, he should never cross over the 20 millisievert per year. Okay. When it comes to public, it is 1/20th of the occupational worker. That means the public can get only 1 millisievert per year, averaged over 5 years. When you get to the eye lens, it is 150 millisievert. For public, again, 1/100th of it, 15 millisievert. And when we come to equivalent dose for a pregnant woman during the pregnancy period, is only 2 millisievert for the abdominal surface region. When we talk about whole body dose, we talk 20 millisievert on the chest. For pregnant females, we talk about 2 millisievert for the abdominal surface, which means then if the first trimester is also very important and the third trimester is also very important. So if any radiological investigations have to be done, you have to consult the radiologist and take all the precaution for putting a shielding above as well as have a dose care function to limit the radiation as much as possible. Now I'm coming to the topic of radiation safety, talking about when we talk about anything, whatever we operate upon, either a bicycle or a car, always all of them have certain built-in safety. Okay, built-in safety is always there in all radiation equipments as well. But we also have to concentrate on the operational safety, because if both together can only give a safe practice of radiation in healthcare. So the equipments, all of them come with built-in safety like a door interlock, operational interlock, and all other safety features of having a protective shields, patient shields. But again, operational limits and safe operational practice SOPs have to be defined for all radiation functioning. So how should we practice radiation in all the radiation environment? Is that there are three important aspects: time, distance, shielding. When we come to this, is there any one thing which is most important? Is the shielding most important? If we do too much of shielding, can we get away with the distance and time? It's not true. So all of them, shielding, time, distance, all three are effectively needed, and three have to be optimized in such a manner. Like for example, if you're doing a fluoroscopy, I will explain it, that staying 1 meter away will reduce the dose much. But staying 1 meter away, you may not be able to do the functions when you are doing interventional radiology. So there you may have to compromise the distance. The moment you compromise the distance, then you have to have a protective shielding material, additional shielding material inside, and try to keep the time as low as possible. So the total radiation exposure of an individual is directly proportional to the time that a person is exposed to a source, which means before starting the beam, be well prepared. What procedure you are going to do, what are the additional instruction you want to give to a support staff, you first itself tell them, okay, when at this point in time I would be asking for this, please give me immediately, and prepare yourself for the task, and then start the procedure, so that there is no time delay in the procedure for unnecessarily in between to organize something. Is that okay? Now the distance inverse square law. If you increase the distance by a radius of 1 r to r, the radiation intensity falls 1/4. If you have increased the distance 2 times and 3 r, you decrease the radiation to 1/9. So the distance you go more, the radiation inversely falls down, like the half-life. Half-life also falls in the same pattern. But of course, we know for certain type of a, like when you are doing an X-ray investigation, it's very comfortable. Ask the patient to stand near the wall, come to the control console, which is like 3 or 4 meters, and give an exposure. The staff who is taking a radiation abdomen or a chest X-ray is completely safe. But when it comes to intervention, you cannot do that. So you would be putting a lead apron as an additional shielding material in order to protect yourself. That is why when in the fluoroscopy, you remember that you may need to use protective devices in order to additionally reduce the radiation dose to the radiation worker. Another important aspect one has to keep it in mind, radiation is coming from this X-ray machine, and this beam is considered as a useful beam. Now what are all unuseful? The radiation which gets into the patient and scatter. This is a unwanted radiation which keeps coming. So a radiation professional, either a doctor or a staff nurse who is close by, will always get a radiation if they are doing an interventional procedure. So they need to wear a lead apron to shield that. Similarly, if a X-ray tube has gone for a servicing and the engineers didn't position the X-ray tube properly and put the shielding tabs, there is a possibility for extra radiation leakage from the apparatus of the source housing. So a complete quality assurance and quality control of the X-ray equipment after every repair is mandatory. So here in this, you could see that this X-ray tube, X-ray C-arm, where you are doing a fluoroscopy evaluation to see, there are lead apron patterns here so that the scatter dose from the patient is attenuated. Further, you will be wearing a lead apron to reduce the dose to here. And when you are wearing a lead apron, you will be always wearing a TLD personal monitoring badge, which I will tell you in the upcoming lecture, upcoming slides. You will be wearing below the lead apron, because the thermoluminescence dosimeter is to document the radiation dose what you have received, not the apron. Okay, similarly, you have bedside trolley with a lead glass. Have you heard about a lead glass? We always see a glass which you can see through, but there are lead which is mixed in this glass, and it can attenuate like a shielding material. So in fluoroscopies, we have a lead shield with a lead glass. Now, for an ideal X-ray unit the room size should be at least 18 meters, and the wall should be made of brick 35 millimeters, and there should not be any windows where the radiation can scatter and someone can sitting adjacent to the X-ray installation gets the radiation dose. Plus the lead doors and the windows are always lead lined. They are 1.7 millimeter lead lined on the door for all X-ray installations. Now coming to the shielding. If you come to the shielding for an X-ray installation, it is only a brick wall. But when it comes to nuclear medicine, PET gamma camera or radiotherapy, a telecobalt or a linear accelerator, the shielding is very large because they use a very large radioactive isotope of a very high strength. Okay, so these kind of a units the source is generally kept here, and the source is housed on a uranium container, which is much more shielded and safe for practicing. This rotates across. The patient is lying on the couch, and this can be shifted up and down, and the couch rotates across the patient like a axial CT, and you can treat the patient. So the shielding requirements are very stringent. This is a cross cut like this. I'm doing two cross cuts, one this and one sagittal. This is a cross cut showing the maze wall. The person, when you enter like this, the radiation equipment is housed here. The primary radiation beams falls here. So you see the shielding thickness of this. This can be around 1.2 meter to 1.5 meters or even 2 meters for a high energy mission. These are around less than 1 meter. So these maze walls, a huge construction, is very well needed for the purpose of eye shielding, which we call it as a primary barrier and a secondary barrier. And if we look into the sagittal view, below is the floor and this is the false ceiling. Like in our department, radiotherapy, above the radiotherapy is our mini auditorium. So the barrier, if you see the beam, is primary barrier, which is of a huge concrete thickness, like 2 meters, compared to this is 1 meter. So a heavy construction is required for radiotherapy purposes, because this gets a cobalt pellet which gets into BRC for an artificial radioisotope bombarded from a neutron. Cobalt 60 is bombarded with the neutron to become radioactivity, and it decays to nickel, emitting gamma and beta rays. So this radioactive source is housed here with a thick container of tungsten with uranium mixture, and this source, due to a pressure mechanism, pushed here for source on and off position. When it comes here, the beam is treated here for the radiation. So there could be a possibility of a radiation source struck and many other incidents where people have to practice this very safely. I'm not going to bother about you with the entire radiotherapy practice. So coming to what kind of a practice we need. So don't stay unnecessarily in radiation area, which means I'm not asking you, please do not come to radiotherapy. Okay, you are safe to come to radiotherapy, and even once in a while you can go into a radiotherapy installation and see. But I know a lot of anesthetists do posted on the radiotherapy equipment for sedation of the children during the radiotherapy procedures. So they come frequently, but they cannot be posted completely. If they're posted completely, we have to give them film badges and monitor the radiation doses. These are the regulatory requirements. Otherwise, radiation may, even the control console, the radiation workers are as safe as the other population. Like I would like to tell you, we are monitoring the radiation safety for the all the radiation workers. We see a small increase of 1 millisievert extra for the radiotherapy department or a nuclear medicine department. Sometimes nuclear medicine is slightly larger than radiotherapy or radiodiagnosis because they deal with contaminated radiations. Although the radioisotope is of a small activity, due to contamination process, sometimes they get a radiation. And even then the radiation is, I would say, half of the background radiation. On average, I don't see that they cross beyond 1.5 millisievert per year, any radiation worker in this institute. Okay, so for this installation, you may be seeing zone monitors which are monitored to say that the radiation is safe or not. So when you are entering a radiation department, you should see whether there is a survey meter and the survey meter is showing a off position. If it is off, it is safe to enter in. If it is not, it is not safe to enter in. So this is for general public and for radiation fraternity as well as medical fraternity to understand and adhere to, respect all the monitor and door interlocks and other thing, and see these symbols. When it is X-ray is on, there will be a radiation door interlock showing that the radiation is on. So now, apart from this area monitoring, you have personal monitoring devices like the TLD. TLD is a thermoluminescence dosimeter. There is a lithium fluoride capsules. 3 capsules are kept here, and this is weared on the badge like the chest for the radiation workers to know what is the radiation documented on them by working in this radiation environment. Okay, and for all radiation environment, you will be seeing radiation symbols like this, and I will tell the specific definition and the dimension of the symbol in the last slide. So now coming to operational safety, radiation equipments cannot be operated without certified or trained persons, and all radiation installations have to be monitored every monthly for radiation safe survey and personal monitoring by personal film batch services, and all the radioactive source has to be securely stored and inventory to be maintained, and there has to be an emergency preparedness plan in case of a radiation accident in radiotherapy or nuclear medicine. In radio diagnosis, always there is not a major accident can happen, but still all the equipment has to be monitored for leakage radiation and scatter radiation on a periodic intervals. So when you talk coming about radiation monitoring, monitor individual doses regularly of a patient, of a staff. Every 3 months, the staff is being given a new badge, and the old badge goes to a respiratory research laboratory, and they read the personal monitoring doses and share with us. And these reports are available for all radiation workers, and this radiation worker records are lifelong. It is a cumulative exposure for their life. So whenever they go from one organization to another organization, they have to disclose their personal monitoring film badge number and the personal monitoring institution number for them to add the radiation exposure for their cumulative exposure. It is a very important regulation by the Atomic Energy Regulatory Board that you cannot hide your radiation dose what you worked in any organization. So there are various types of personal dosimeters like a film badge, thermoluminescent dosimeters, and as these thermoluminescent dosimeters we can assess only after 3 months, because a radiation accident we cannot know immediately. So for that purpose we have pocket dosimeters and bleepers, which will give bleeps depending upon the intensity of radiation. So these kind of radiation instruments are used by the radiologist, nuclear medicine specialist, technologist, and the radiation safety officer to handle radiation emergencies. And these personal monitoring TLD badges are worn by every radiation workers. And if you are posted in radiation work area doing C-arm intervention, you should demand for a film badge, and you should wear it routinely whenever you are in the radiation area. And apart from the chest X-ray, you could also find the nuclear medicine people keep wearing some wrist and finger also, because if they do so much of exposures by hand during a investigations of preparing a radioisotope in the cyclotron, injecting that isotope to a patient, then they need to be extra monitored the dose levels at the hand, at the wrist level, as well as the in addition to the whole body chest dose. So as I said in the earlier, Atomic Energy Regulatory Board have stringent guidelines that without licensing you cannot practice. You have to do the surveillance of the radiation survey routinely and have licenses for operation from the competent authority of Atomic Energy Regulatory Board. And if we don't do all these stages and anything anywhere harmful, they have also now started e-licensing of radiation applications, which they call it ELORA. That means all radiation equipment, when you procure, you have to disclose them and you have to take licenses. When you decommission, you have to tell them all the decommissioning processes and dispose it off. A safe disposal is also very important. And all radiation workers have to be enrolled into the ELORA, and they do surprise checks and they do come for visits to have a emergency survey and emergency visit, and if they find anything, they can penalize the institute and they can put a full stop to the entire radiotherapy or radiological or nuclear medicine services to stop till the things are in order. So what are the prerequisites for licenses? We have to have any equipment before procurement. You have to tell what type of equipment. You cannot just take any radioisotope equipment anywhere. Those equipment have to be type approved by ARB, and you have to approve the installation. You have to disclose the storage pattern. You have to confirm the facilities for the area and personal monitoring. That means a new institution, if you are creating, if you have not applied for TLD services and the survey meters, they will never give you a permission to start even the X-ray. And similarly, you have to have qualified staff and enrolled into the processes in order to have the licenses up and ongoing. So as I said, there are various instruments used for surveying purposes and for dose measurement purposes in the CT and in the linear accelerators, which I will not go on deep. Okay. So the last one I want to say, the radioactive isotope symbol should be either of these two, figure 1 or figure 2. It could be either a magenta color or a black color, and you could see a small circle of radius R, and if this is R, 1.5 times should be these blades, and 5 times will be the outer ring. The dimension and the ratios are important. You cannot just draw something and put this is my radiation symbol. You have to have the radiation symbol adhere to the principles and the regulations regulated by them, and it should be exactly in this dimension. And these blades are 60 degree. So 60, 60, 60. You see 3 blades and 3 vacuum space together form 360 degree. So the angles and other things have to be respected in the same way. So this is what is the ideal radiation symbol, which you should be able to see in radio nuclear medicine department or radiotherapy, or even in endocrinology and many other immunology where you use research for radioisotopes. And wherever you have X-ray installations, the X-ray installation symbol is this, a X-ray coming out by this, and there should be a caution X-ray in English, and you have to write this, and it also to be written on Hindi like this. So this is the regulatory requirements. Wherever there is a X-ray installation, this symbol should be placed. And in the CT and other thing also, we have to put a symbol like this for pregnant females to understand that if they are pregnant, they have to inform the doctor. If they are going to be, they are expecting, they should inform it. It is important. So the take-home message from this lecture is that main principles is that the radiation should be justified. There should be benefit. The benefit should be larger than the risk. And always use the principle of as low as reasonable is important. The dose limit should be always respected for patient dose as well as radiation staff. Distance, time, shielding, all the three are very important. Together, all the three optimizes the radiation protection. All the three are equally important. And you have to have a personal monitoring system, area monitoring system. Understand that there is no safe dose of radiation, and be careful and not fearful. Thank you.